Good afternoon and welcome. I'd like to acknowledge the local custodians of the land in which we meet today and honour elders past, present and emerging. I'm Mel Wilkinson from the education team at the Primary Health Network based on the Central Coast. Welcome to Mastermind's Air and PRODA today. We have the lovely Casey with us who'll be presenting. She's the immunisation lead at the Primary Health Network, and we thank her for being with us today. Just a little bit of housekeeping. There will be a poll that will pop up at the end. This is how we will do our evaluations. Your input is really valuable to us, so I encourage you strongly to complete that. Please place any questions that you have in the chat box. If we have time, we will, Casey will answer those towards the end of the session. If we run out of time, due to the number of responses that we have, we'll email those through and Casey will follow those up via email. Thank you to those people that have already submitted questions. We've had a few questions that have come through already as requested, and Casey will also address those today. So that's about it from me. I'm going to hand over now to Casey, and thank you everybody. Enjoy the session.
Hi, so thanks Mel, thanks for that introduction. So I'm coming to you guys from my son's bedroom on the mid-north coast, from the land of the Biripi people. So yes, today I'm going to talk to you about how to access air via PRODA. I'll also discuss a couple of reports that you can generate to follow up on people who are overdue for an immunisation. So I do have my contact details up here on the screen. So you are welcome to email me or phone me if you have any questions, but you can also contact your PCIO. So let's get started. So I'll just start off with a little bit of information for you. So it's now mandatory for the reporting of vaccines to go on to the Australian Immunisation Register. So on the 3rd of December last year, the Australian Immunisation Register Amendment, the reporting bill, entered Parliament. So the effect of the amendments in the bill is to ensure that all vaccination providers report all vaccines given to the air. So this means that in the near future, every Australian will be able to access their vaccine history through a safe and secure register. So while the bill includes the COVID-19 vaccine from the 1st of March this year, from the 1st of July this year, it will be mandatory for all other vaccines to be entered. So what you can do is to make sure that your information that you're entering into your clinical software is getting transmitted to the air is to do some quality checks. So some suggestions for quality checks that you can do are here on the screen. So you can extract a list of vaccinations given via your practice software, and then you can check those encounters against the air. Or if you didn't want to look at all of them, you could just do a bit of a random selection and check the status on the air. You can extract a 10A report from the air and compare this against a list of vaccinations given by your clinical software, and I will talk about these reports later. And if you ever receive a call from families about the air not being up to date because they've received a letter from Centrelink, you'll be able to check your practice software just to see if there was an error and when the vaccine was recorded or transmitted. So air is our only source of truth. So whilst what you enter might go incorrectly into your clinical software, if there's something wrong with like a person's date of birth, or there's something wrong with a vaccine sequence number or something, it won't go up to the air. So that's why it's really important that you have the ability to check. So there'll be a civil penalty that will equate to $6,660 if this isn't being complied with. So if your software is transmitting to the air, that's why it's important that you perform quality checks. So does anyone have any other suggestions? We can send these out to practices if anyone's got anything to say. So just a little aside, in case you haven't seen it, there's now a new field to capture vaccine serial numbers. This was added to the air site on the 16th of December of last year. So this will support the rollout of the COVID-19 vaccines across Australia and assist the Commonwealth, state and territory governments to track all vaccines administered to the public. That's outlined in the Australian COVID-19 vaccination policy. At this current time, it's not mandatory for vaccination providers to record vaccine serial numbers. However, further advice about recording the COVID-19 vaccines onto the air will be provided soon. So why is it important that you be able to access the air and ensure that the information that you're entering is being transmitted? So the air is a national register that records all vaccines that are given to people in Australia, which I'm sure you know. And like I've previously said, the federal government has made it mandatory to record COVID-19 vaccines, and this will also be extended to include all vaccines, like I said. You'll be able to record an encounter onto the air directly, update an encounter, and with air access, you have the ability to view a patient's immunisation history. So this is really important as it will support your clinical decision making to ensure that a person is properly vaccinated. So individual patients, if they want to, can get a copy of their immunisation history statement from the Australian Immunisation Register. They can get this through their MyGov website using their Medicare online account, or they can call the air. And it can take up to 14 days for it to be sent in the mail, so you just might want to remind them of that. So for privacy reasons, anyone aged 14 or older can get their own immunisation history statement. So that's really good. You'll also be able to print them out. I think I did say that. So there are some great resources that you can use to ensure that the data you submitted is correct, or to clean up any errors that you may find on the air. So these resources are in the links here in the presentation that you'll receive. So what is PRODA? Authentication files are being decommissioned. This means that the only way you'll now be able to access the air is through a PRODA account and logging on to HPOS. Because I'm not sure of everyone's understanding about what I'm talking about today, I'll just go over what PRODA is and what HPOS is. So PRODA stands for Provider Digital Access, and this is an online identity proofing and authentication system that provides secure access to government online services such as Health Professional Online Services, HPOS, which I've got an explanation for there, and Childcare Provider Entry Point. So PRODA enables secure access to a range of government online services that verifies an individual's identity and verifies an organisation against information on the Australian Business Register. And as it says there, HPOS is the acronym for Health Professional Online Services, and it's a fast and secure way for health professionals and administrators to do business with Services Australia. So last year on the 7th of December, the PHN hosted an immunisation update in conjunction with the immunisation team at the Public Health Unit. And in this update, Lauren Dalton presented. So Lauren's from NCERS, and she provided participants with an analogy that a PRODA account is similar to the Opal card that you use to get onto public transport. And I totally agree with this analogy. I liken PRODA to being a key that gets you into the door, which is HPOS, and this is where the air sits at. So if you haven't already created a PRODA account, it takes about 20 minutes, all going well, and you need 3 forms of identification. So please note that when proving your identity, you need to create your account using your current legal name as shown on your identity documents. The names you input will be used to verify your identity documents at a later step, and any inconsistencies will result in verification failure. If your current name is different to the name on any of your documents, you'll need to provide either an official marriage certificate or a change of name certificate. So that marriage certificate can't be the one that you received in the church. It needs to be the one that's issued by State or Territory Register of Births, Deaths and Marriages. So once your identity has been confirmed, it's happy days. A registration authority or an RA number will be issued to you via email. So you need to keep this number. It stays with you forever, and it's used to link you and access services. So GPs, along with nurse practitioners and midwives who have a provider number already, they can access the Australian Immunisation Register with their individual PRODA accounts through HPOS. So under resources on this slide, there's a link to the Services Australia website that links you to a page on how you can do this linkage. So nurses and other support staff working within general practice need to be a delegate of a GP to have access to the air. among other delegation functions you can have, but we're focusing on the air today. So the air can then be accessed by you, the delegate, to act on behalf of the healthcare professional. So once you've created an individual PRODA account as a GP, you need to link the provider number to services to show up in HPOS, and then that air tile will appear. So that's a one-off thing. The GP can then nominate a delegate, or if you're a nurse or practice manager or support staff, you'll log on to PRODA with your individual account, get onto HPOS, and then you can request the delegations to the air. So if a nurse or another staff member is delegated access by the GP or the practice, then that person is still logging in as an individual and you're acting on behalf of the GP or the organisation. So any action on the air done by this person can be traced. The delegations can be removed at any time and do expire after 12 months, and so need to be re-established. So there's two types of PRODA accounts that you can set up to use in general practice to access the air. So one's for an individual and the other is for an organisation. So it's suggested that the individual delegations are easier if you're working in general practice, but it's totally up to you on what works right for your business. So an individual PRODA account, it's easy to set up. Like I said, your GPs already have access. You can get access to the Air 10A reports that I mentioned earlier and that I will discuss a little bit further down the track. So nurses and support staff, like I have said, can act on behalf of an individual GP. So the benefits, delegating access to the air for support staff will enable them to access the air on the provider's behalf, which is what I've said, sorry. So delegates can have a range of access to HPOS functions and information that's held by Services Australia. So PRODA for an organisation, as a practice manager, you might want to set this up, or as a principal GP or GP. You'd need to register your business with PRODA. You need to set up each GP and other staff against the business, and you won't have access to the Air 10A reports. So at the bottom of the screen here, I've added some resources that you can use to help you with this process. So I have mentioned the Air Overdue 10A reports. And the AIR produces statistical and identified reports for recognised vaccination providers. So when you have individual PRODA access, like I said, you can request these reports, and this is one that we recommend. So the Overdue Air 10A report identifies patients that are due or overdue for an immunisation. So it's for all providers that are linked to the One Practice PIP ID. You can use this to identify and record patients that are due or overdue for their immunisation, or identify any transmission errors and missing information that's on the air. You can break this information down by MBS service date range. However, only accredited practices can use the 10A report. So if you're not an accredited practice, you can access the 11B report, and this will list all overdue patients that's linked to one specific provider. So I've provided links here on this page that are available from Services Australia regarding the Air 10A due and overdue report and the national due and overdue rules. However, I've also created some cheat sheets that are available to guide you through all that we've discussed today, and that we can send out with the presentation, or you can get them off your friendly PCIO. So here's an example of the cheat sheets that we have available that'll help you through everything that we've discussed. You also have some e-learning modules that are available through the Services Australia website that can help you understand how to access and record information on the air. So the program covers accessing air for the first time, submitting information to the air, overseas immunisations and immunisation medical exemptions. So I suggest you take a look at the submitting information to the air module. Okay, so I'm zipping through this, sorry. So I have had a few questions come in, and if anyone's email any questions through to Mel, I will attempt to answer them. If I can't answer them, I'll get the answer for you, and we'll email them out as like an FAQ for everyone. So one nurse asked me, do you think nurses will ever be able to go onto the air without having to be delegated by a GP? It can be frustrating getting them to set it all up. Unfortunately, the answer to this is no. Nurses, apologies, nurses and support staff are unable to access the air site without being a delegate, as they do not have a Medicare provider number. So because there's a lot of confidential information that's up there on the air, and because of the strict privacy laws surrounding it, you need to be linked to a provider number for traceability. So another question from a practice manager. So if I register my organisation and link my RNs to that, do I still need to get my GPs to set up individual accounts and delegate to staff? So the answer to this is, once you register the business with PRODA, you do not need to get the individual GPs to create their own PRODA accounts unless they wish to access HPOS themselves, okay? So you can then set the nurses and any other support staff linked to the practice against the business. But like I said earlier, it's suggested by one of my contacts in Services Australia that individual delegations are much easier. And as I said earlier, GPs already have access. You can get the 10A reports, and then individuals are delegated to act on behalf of an individual GP. So there was a couple of questions that came up from Lauren's presentation last year. And one of these, and these are quite good and interesting and relevant to us today. So the question is, should practice nurses and practice managers acquire delegation from each and every GP in the practice that they're working? The answer is yes, because the delegate can log on to the air via PRODA and select the GP that they are acting on behalf of. So another question, how can I send a secure email to the air if I'm a GP, practice nurse or a practice manager? So use the HPOS messages tile, and then documents can be attached to the message. The medical practitioner, when they set you up as a delegate, need to tick my mailbox in the HPOS delegation options, and that'll delegate the access. And I've zipped through that, of course. So thank you so much for joining me today. And I certainly hope you feel a bit better about how you can get access to the air. Don't forget to save the date from Friday the 10th to Saturday the 11th of September this year for our fantastic immunisation conference. This one's going to be titled Coast to Country. Hopefully we'll be able to get together, but if not, we're also looking at an online forum with world-renowned presenters and our fabulous immunisation team from the PHU. So please don't hesitate to get in contact with me or your PCIO, who'll be more than happy to provide you with assistance. So like I said, I really hope that this has helped you understand how you can access the air, and send through any questions for me. Thanks, Mel.
If you do have any questions, could you please place them into the chat box? That would be great. Looks that was very comprehensive there, Casey. I think you've covered a lot of information, which has been amazing. We thank you for that. We've got record numbers online today, and thank you everyone for attending. Any further questions that you'd like to submit, please submit via email, and they will go through to Casey and she'll get back to you as well on those. A copy of the presentation will be available on the website and also through PeopleBank, and we'll also be recording this session, so you'll be able to watch it and refer back to it at any time. Thanks once again, Casey, for presenting today. Really appreciate it. It's an amazing topic, and thank you so much. Thank you everyone for attending. Enjoy your afternoon, and we'll see you soon. Thank you.
Thanks, everyone. Bye.